Radicular retainers. These are the contents that will be discussed in this video. Introduction. The restoration of the endodontically treated tooth is complicated because of the destruction by caries, previous restorations, trauma, or endodontic access preparation. These require restoration because of the dehydrated dentin, decreased structural integrity, impaired neurosensory feedback mechanism. For restoration of extensively damaged teeth, we use post and bore. The post is the part that goes into the root structure, and core is the part that builds up the crown structure. Cores were fabricated initially from gold or silver. It was first introduced by Pierre Fauchet in the year 1747. In 1800s, porcelain privet crowns were used. Early privet crowns were used where the wooden post called as morbid humerus were used, and in 1878, Richmond crown, that is, a one-piece dowel and the crown together is called as Richmond crown, which further led to the creation of post and core. Coming to the definitions, what is a dowel or a post? According to GPT-9, the dowel is metal post or other rigid restorative material placed in the radicular portion of a non-vital tooth. A dowel, usually made of metal, will be fitted into a prepared canal of a natural tooth. When combined with an artificial crown or core, it provides retention and resistance for the restoration. A core refers to a properly shaped and well structure, which replaces the missing permanent structure and retains the final restoration. A ferrule is defined as a metal band that encircles the external dimension of the residual tooth. According to Rosenstein. According to me, a ferrule is a metal ring or a cap that will be placed around the end of the tooth, giving it an added strength. The ferrule around the circumference of the tooth strengthens it by increasing the resistance to wedging forces. Why to restore? As a prosthodontist, we can use the abutments for FPD, RPD, and overdenture. As a restorative dentist, we can increase the clinical longevity of these teeth. Pre-operative assessment. How do you assess the tooth before beginning the treatment? Endodontic and periodontal evaluation. Apical seal. Check for the apical seal. Percussion. Palpate the tooth. Check for the presence of sinus run. Diagnostic probing and check for the mobility of the tooth. Restorative evaluation. The amount of remaining tooth structure, how much is it available? The anatomical position of the tooth. Is it an anterior tooth or a posterior tooth? So that will determine the functional load on the tooth. And the aesthetic requirement of the tooth. If it's anterior, there is going to be a lot of aesthetic demand. The amount of remaining tooth structure for the anterior teeth. We do not need pores and fill coverage crowns. Sound tooth with accessibility, lack of corneal structure. And where there is more lack of corneal structure, that is when we will go for a pose followed by a full coverage wall. Anterior teeth are inclined at an angle to the occlusal plane. So there won't be much of occlusal load directed to the tooth. Posterior teeth. They carry greater occlusal loads. So we would need minimal occlusal axis preparation. Teeth with existing restoration involving noise and ridge, or those with extensive loss of tooth structure are indicated to go for post and core. Wherever possible, post should be avoided in posterior teeth as the roots are often narrow and not curved. What are the ideal properties of the post? Maximum protection to the adequate retention within the root, maximum retention of the bore and the crown, maximum protection of the crown margins when seen, pleasing aesthetics, high radiographic visibility, retrievability, and bio. According to DCNA 2002, posts are classified as metallic posts and non-metallic posts. The posts can be custom cast posts or prefabricated posts. Non-metallic posts can be carbon fiber, zirconia posts, or woven fiber composite posts. The prefabricated posts are available as passive posts and active posts. As you can see on the passive posts, there are not much of threads. These are tapered posts. Active pores can be cylindrical pores or tapered pores with too much of threads. Parallel pores provides greater rotation, and active pores are located in short canal space. Non-metallic pores, carbon fiber pores, bundles of stretched aligned carbon fibers will be embedded into an epoxy matrix. The modulus of elasticity will be similar to dentin. It can bond to a dentin, but it is anesthetic and caviar-centered. Tooth color pores, zirconium coated carbon fiber post, aesthetic post, all zirconium post, fiber reinforced post, light post, lucent anchor, fibricol post. Zirconium post modulus of elasticity is more than the stainless steel. These are but difficult to retrieve. Core. What are the desirable features of a core material? Core is the portion where the crown would come in place. So adequate compressive strength, sufficient flexural strength, low compatibility, resistant to leakage of oral fluids at the core or the tooth interface, ease of manipulation. They bond easily to the turbinate tooth structure, dimensionally stable, thermal coefficient of expansion and contraction, inhibition of dental caries. How do we classify core materials? There are cast core, plastic core material. Cast core is the metal cores or the ceramic to zirconium doubles. Plastic core could be amalgam, GIC made from GIC, and modified GIC or dual fiber reinforced cores. So principles of the preparation. The basic principles of the preparation are include the conservation of the tooth structure, retention form, resistance form. So conservation of the tooth structure here for the portion code it will depict the preparation of canal and the preparation of the coronal tissue. Resistance form is where there will be even distribution of stress and the rotational resistance. So conservation of tooth structure, preparation of the canal. Remove the minimal tooth structure from the canal. Excessive enlargement will perforate or especially weaken the tooth. The thickness of the remaining dentin will indicate the fracture resistance form. Preparation of coronal tissue. If more than 2 mm of coronal tooth structure remains, the post design probably has implemented role in the fracture resistance of a restored tooth. A key element for the tooth preparation is the incorporation of a ferrule. Cervical ferrule. It is a metal band or ring used to fit the tooth or crown of a tooth. Increase fracture resistance and it is anti-rotational. So when there is a ferrule, the amount of anti-rotational displacement of the post and the core is very minimal. But without ferrule, there are chances for leakage and also displacement or fracture of the core, which can in turn lead to fracture of the wood. What if the tooth has inadequate formal structure to create a ferrule? Consider crown lengthening and or extrusion. Retention form. Post retention is affected and usually by the preparation geometry, post length and diameter, surface texture, and heating agent. A post that is too short will fail. Ideally, the post should be 5 mm with the apical seal and not less than 3 mm. Do not increase the post diameter in an attempt to increase the retention. Ideally, it should not be no wider than the 1/3 of the root structure and 2 mm of the tooth structure. A serrated or a roughened post is more retentive than a smooth one. Controlled grooving of the post and the root canal increases the retention of a tapered post. Rather than using the traditional cements which have little effects on the luting, adhesive resin luting cements would provide an improved retention. The resistance, the influence of the post design will be tested using the photoelastic materials, strain gauges, and finite element analysis. The greatest stress concentrations are found at the shoulder, particularly in the interproximal region and at the apex. Stresses are reduced as the post length increases. Higher stress can be generated during insertion, parallel in the parallel servo force. Sharp angles should be avoided because they produce high stress during loading. The rotation can be prevented by the vertical coronal bone. A small groove will be placed in the canal. Roots will be most bulkiest in the lingual aspect. Preparation of the host and the core is a three-stage operation. Involves removal of the root canal filling material to the appropriate depth, and then followed by enlargement of the canal and preparation of the coronal tooth structure. A removal of the endodontic filling material can be removed by chemical removal, thermal removal using heat, or mechanical removal. Rotary instruments can disturb the apical cell if used immediately after obturation. Calculate the appropriate length of the post first. If Kattapacha is old and has lost its thermoplasticity, use a rotary instrument. A piezo reamer or glazed living drills can be used. Before enlargement of the canal, the type of post system to be used should be chosen. So the size of the post is determined. Then the Kattapaka are removed using the gauge skeleton in a sequential length, and then the core space is preparation of the coronal tooth structure. Remove all the internal and external undercuts. Prepare perpendicular to the post to create a positive stop and to prevent overseating and splitting of the tooth. If insufficient, tooth structure remains for this picture and anti-rotation groove to be placed in the canal. Post and core fabrication. As we discussed, the prefabricated post can be metallic or non-metallic, and the custom-made post can be made by direct procedure inside the patient's mouth and indirect procedure in the laboratory. So the post in the first image shows the post that will be selected and the core build-up done in the second picture, followed by finishing of the core build-up. Procedure for custom cast post. Determine the length of the post, place it inside the patient's mouth, and do a wax packing technique. That is, in this picture, it is done using the inlay wax, and the entire pattern is removed and it is fabricated. Indirect procedure, pieces of orthodontic wires lubricate the canal and the lenticular spiral used. Syringe in the impression material can also be used. Apply a thin coat sticky wax to the plastic post. After lubricating the stone cast, add the soft inlay wax and ingredients. And once the pattern is done, remove the pattern, invest it, and casting is done. Cementation. Posting post should be inserted with gentle pressure. A rotary lentillo paste filler or cement will be used. A parallel sided post is being used. A groove, if a parallel sided post is being used, a groove should be placed along the side of. What to do for the removal of the existing post? The existing post could be removed using an ultrasonic powered chisel at Nasir and Treacle. Thank you.